Hey everyone, this is Ciara. I'm one of the nurse injectors here at the spa, and I also have Taylor.
I'm also a nurse injector here at the spa.
And we both do perform this new amazing innovative tool called Sylfirm. So thanks for tuning into our chat. We're just going to go over all the ins and outs, hopefully answer any questions you have about this, and have this back for you to reference at a later date. So let's start off by just talking about what this treatment actually is. So I'll let Taylor go ahead and take this one. Why would you choose RF microneedling?
So RF microneedling with Sylfirm combines pulse and continuous wave radio frequency. So it allows for precise depth targeting and treatment of various skin issues. So it's very versatile and treats so many different things. And we can use it year round, which is pretty uncommon for treatments in the aesthetic industry. There are so many that work so well that we cannot do during the spring and summer months because of sun exposure. So this is nice to have in our toolbox to use. So this treats concerns like skin laxity, pigmentation, fine lines, wrinkles, acne, acne scarring. It treats melasma, which is a game changer because there just is not a lot out there that can actually treat melasma. It also treats pore size and scars, rosacea, stretch marks, and that's just to name a few things.
So I'm sure that most of you all, if you've done any research on RF microneedling, you've probably heard of Morpheus. So Morpheus is kind of the first one to the market. This is one that a lot of people are aware of, but are kind of afraid of it because of how painful it was and also because of some adverse reactions that were possible. This is why we chose this device over that, because you don't have to worry about that. With Sylfirm, this is 3 generations newer than what Morpheus is. So by having this newer technology, you decrease all of your risks of burns, of permanent grid marks, of hyper or hypopigmentation. It's a very precise tool that just has such an accelerated technology, but also really ensures safety. So what's different is this one actually does have precise depths to where we can target different issues, which is why it has so many indications, but it also just makes it a little bit less painful. And I think that's the biggest thing, is that you're not going to have to worry about whether or not you can make it through a treatment. Unlike Morpheus, it doesn't hurt quite as bad. So I don't know if you have anything to add on to that.
No, the fact that it's so tolerable and the downtime is so much less than most any other treatment that we do is just, it's a game changer.
Yeah, I think that's a good point to hit. I mean, with this one, we don't have to make you look scary to give you a good result. And I think that's the biggest change with this new technology, is that you can literally go to work the next day. You could probably go to work the day of. Now, you might be a little red, but that's really about it.
Yeah. So, am I a candidate and how many treatments will I need? So, everyone is a candidate for Sylfirm. It treats all skin types and, like I mentioned before, so many different skin concerns. It's so versatile and suitable for everything. So, for best results, we do recommend a series of 3 to 4 treatments, sometimes 6. It really just depends on what we're treating and how severe the issue is that we're treating. So for a package of 3 treatments, we start at $3,000, and this covers the full face and neck, and it includes exosomes, which will speed up the recovery and improve your outcomes.
Mm-hmm.
And then obviously everyone's going to be different, so we will just have to, consult and talk about what we think you're going to need and tell you up front, like, look, this is, a little more severe, so you might want to plan on 6 treatments, or you're going to be good with 3. So
all right, so I know Taylor kind of touched on exosomes a little bit. So exosomes are what we use for aftercare. Basically, I'll try to make this as simple as I can. Exosomes are part of a cell that is derived, that is responsible to tell the other cells what to do. So basically, when we put the serum on immediately after, it goes into these channels that we've created, and it tells your body to heal. It reduces redness, it reduces inflammation. It also generates a lot more collagen and elastin than you would have without putting anything on the face. So it's very clean. It's made in a lab. There's no genetic components attached to this at all, but it is literally part of a cell. And the nicest part about it is that the aftercare is so easy. You literally rub these exosomes in. We have you try to get them all used up within 12 to 24 hours. They do denature after that point, so it's important to go ahead and try to use them as quickly as you can just to ensure that you do get the best result. But like we touched on already, your downtime is nothing, and it's partially because of the magic of these exosomes.
Yeah, definitely. I mean, most of our patients, by the time they leave and they check out, their redness is like cut in half almost.
Yeah,
and then definitely the next day when you wake up, it's put your makeup on and you're good to go. So, what to expect during your Sylfirm appointment? So, during your Sylfirm appointment, we will start off by taking your photos. We take photos in our photo room, and we also will take photos with our Visia device, which will give you a skin analysis showing everything from pigmentation to fine lines and wrinkles to redness and inflammation. We do take these photos every time you come so we can track your progress, which is really, really cool to see. After photos are taken, we apply topical numbing cream so that you are nice and numb and it's super comfortable. And then we do the treatment. So the treatment takes about an hour, again, depending on how much we're doing. So if we're treating face and neck, usually you can expect to be here for about an hour. The treatment itself is very tolerable. You'll feel mild heat and a little bit of the pokes from the needles, but again, nothing crazy. And then we apply the exosomes after, and that really helps to cool you off. And then that's it.
Yeah, very easy. A lot of the feedback I've gotten is from people that have done traditional microneedling in the past. They say this is actually easier to get through.
Yeah.
So, and I think part of that is also because you don't have nearly the downtime that you do with typical microneedling. On the body, I do think that it is a little bit more painful than what the face and neck. Face and neck is easy to get through from what I've seen so far. Body is a little bit more intense because we go to a deeper depth. So for the body, we also offer Pronox, which is our laughing gas that you can use. This is safe to kind of take away like the anxiety surrounding the procedure, but you can also drive 15 minutes after discontinuing it, so you don't have to have a driver. Worst case scenario, we can also inject some lidocaine. So really what we're trying to say is that this is a comfortable procedure. If you have been scared of Morpheus in the past, do not be scared of this. This is not as crazy pain-wise, but nobody's quit. Nobody's not been able to get through this.
Right. Yeah. It's been very easy for everyone to make through. Plus, like with this, the needles, the heat, it coagulates the blood. So you don't have that pinpoint bleeding or any blood at all with this. Whereas with traditional microneedling, you do, and you are pretty bloody during that. So that makes this even better. No blood.
So this is just an example of what somebody would look like immediately post-treatment. So as you can see here, we treated her face and neck. So she's a little blotchy. You can see some of the grid marks. Those disappear within, gosh, I think she told me they were gone within like 6 hours. So if that, the exosomes really work to expedite that process, but it's nothing. Like she is legitimately smiling here. This is not just for a pose. It's really not painful. Like once you're done, you're done. You did it and it's easy. People are not scared to come back for their subsequent treatments.
All right. So here are some examples of us treating other areas and other treatment options. So we can treat surgical scars. So here we're treating a tummy tuck scar. We can treat stretch marks too from, having babies, or even just stretch marks, that we tend to get on our hips and thighs. Those can all be treated to help kind of smooth those out and soften those. It works really well. Again, like Ciara was saying, treatments on the body are a little bit more uncomfortable, but it is quick. It is not something you're going to have to sit through for a very long time. And we do have tools in our toolbox to help get you through it, like the Pronox or injectable lidocaine. And of course, we always do topical lidocaine no matter what. But yeah, this is one other option that we can use Sylfirm for.
Another really awesome thing about this device, and another reason why we chose this one, is because it can work as a drug delivery system. So whenever we have someone in here that has some thinning hair, that has some areas that just aren't quite as thick, you can actually use this tool to create those channels for the exosomes to go in so that they can tell the other cells there to create hair follicles. This is an amazing aspect of this treatment. It can be done on male or female clients. Um, it does take a little bit more though. So for hair restoration, it's going to take a little bit longer. You have to wait for your hair to grow, which typically takes about 16 weeks. And then your series hair might be closer to 6 rather than just like the traditional 3. But that's also variable. It depends on the severity. So definitely call us if you are interested in hair restoration. This is a very tailored procedure. So we'll have to get you in, do a consult, and see exactly what would work best for you.
All right, here are some amazing before and afters of Sylfirm X treatments. So the lady on the left has had 3 treatments, amazing lift, amazing, like her under eyes, around her mouth, her jowling looks so much better. And then the lady on the right, again, 3 treatments, amazing results. I mean,
yeah. I think if you're looking for something to where you're going to look refreshed, you're going to look like you have better skin quality, less sun damage, this is the answer for that. With this treatment in particular, I wish that we were allowed to show you the full photo here, because this treatment also differs from other technologies in the past with the fact that it can treat the eyes. So you can go directly over the eyelids. You can go up to the lash line underneath the eye. So that's what's going to help with crepiness, how that skin thins there and those fine lines and wrinkles. So this is another couple before and afters. This is why we include the neck. We cannot make your face look amazing and leave your neck behind. So
yes.
I think it's crucial to do the neck. We want you to match. And that's why we discounted the price to include the neck, because we want you to look your best. There's not a lot of options out there for the neck. I'm sure if you've had issues with that area, if there are things that bother you, you've been told by our practice, other practices, that your options are a little bit more limited. Well, we just added one more to the toolbox. So another example on the right, you can definitely tell that this has done collagen stimulation. So if you can tell from the top one to the bottom one, she does have some volumization there. Now, I am almost willing to bet that she's done other modalities. Mm-hmm. So I think that it's important also to have the right expectation for this procedure and know that, hey, this is going to work on the surface. This is going to go ahead and it's going to help with the texture. It's going to help with collagen. It's going to help with lift, laxity, pore size, all that. But underneath, we might need to go in with some injectables such as Sculptor or filler to really revolumize the face.
Yeah, for sure. I would agree with that. So here's some hair restoration before and afters. These are amazing. So this just goes to show like everyone's different. So you don't see someone that's completely bald on these before and after photos, because it's not going to regrow hair that does not, in an area that does not have hair follicles, which is why, to reiterate Ciara's comment, that, we really need to see you before we can tell you if this is a good treatment option for you as far as hair thinning goes. Of course, it's a great option for everyone for the face and neck, but for hair is a little bit different. But these are amazing before and after. So these are just after, 3 treatments and then 2 treatments, which is very impressive if you ask me.
Yeah, 100%. All right, so what's next? It's time to book. So if you just want to give us a call, one of our coordinators would be happy to go over all the ins and outs with you. If there's anything that we failed to answer in this slideshow, just give us a call. You can shoot us a text. We can bring you in for a free consultation just to see if this really is the treatment for you. I do honestly believe, though, that almost every single person could benefit from this.
Definitely.
So
give us a call. We're excited to see you.
Thank you so much.
Thank you.